Hi, my name is Brooklyn Tanner, and today I'm going to talk about the effects on women after abortion. Almost every day lately, we're seeing something in the news or the television about women and their abortion rights. I had never really thought too much about this until it affected me personally. My then 16-year-old sister decided that she wanted to get an abortion, although she had not considered her other options. Her then 20-year-old boyfriend decided to go to another state with her and pose as her stepbrother, and they were able to get the procedure done. This was done without any of my parents' knowledge or my knowledge. It tore my family apart when we found out. Although our family was devastated, my sister was also devastated. My parents started to argue more about things that dealt with Caitlin. Caitlin started to get really depressed and she didn't really want to do anything. She stopped going out and doing things with her friends. She quit cheer. There were a lot of detrimental effects. She then became very depressed and also had a lot of anxiety. As I watched my sister's life spin out of control from this decision, that if she could just talk to my family and would have been prevented, it would have been a lot better. I really think that if she would have taken the time to consider her other options and thought about her actions, she would have had a better outcome. Abortion is a serious procedure and all other options should be evaluated before you decide to get an abortion. I know that it's hard when women feel like they're stuck with an unwanted pregnancy. However, women who are considering abortion need to be aware of the lifelong problems that come with abortion, especially physiologically. After the procedure of an abortion is completed, a woman can experience several problems. Psychological problems are known to be more prevalent than physical problems, but they have also shown up as well. These complications after the procedure come throughout the woman's lifetime. According to the Center for Disease Control and Prevention, the abortion rate is increasing at a fast pace. The abortion rate for 2013 was 12.5 abortions per 1,000 women aged 15 to 44 years old, and the abortion ratio was 200 abortions per 1,000 live births. That is a crazy statistic to me, that we are killing 200 babies compared to 1,000 babies every day. There are several side effects that come after a woman chooses to have an abortion. Although physical side effects can be present after abortion, physiological and emotional symptoms are much more common for a woman to experience. Some of these symptoms include regret, anger, shame, guilt, sense of loneliness, or isolation. Although there have been several studies showing how an abortion can affect a woman negatively, women are still getting an abortion every day. Is the problem education? Do women not know how this is so detrimental to their life? According to the American Pregnancy Association, abortion can affect each woman differently. Some women report a sense of relief after having an abortion. The reasons for relief also vary from women to women. It is crazy that a woman can abort her baby and describe it as a sense of relief. That is a child that deserves a life. Even if parents didn't plan for this child, there are several other options, such as adoption or taking a family member taking care of the child. Several women do not think of the dangers that come with abortion because often it is not publicized or they are not educated about it. On the Planned Parenthood website, under the topic of abortion, it states, there are two ways of ending a pregnancy: an in-clinic abortion and the abortion pill. Both are safe and very common. This is a surgical procedure that is being performed, and they are not being made realize of the detrimental things that could come with it. I mean, with every surgical procedure, there are complications, and Planned Parenthood is not making it known. They just think that this is a quick fix, and women can just come to their clinic and get an abortion, and everything will be okay. Julia R. Steinberg is an assistant professor in the Department of Family Science. She published an article based on a study performed on women who had previously had an abortion and had reported increased emotional disorders such as panic attacks, STD, post-traumatic stress disorder, alcohol and drug abuse dependence, bipolar disorder, mania, and depression. Women who dread the effects of this abortion really need to realize that although a child is a lot of work, these psychological problems are going to be a lot of work throughout their life as well, and they may ruin the rest of their life. Several women don't understand how birth control can really affect an unwanted pregnancy. I think it's really important that we educate women about the importance of birth control and how much it really can help you. And if you're just able to take a pill every day or get something in your arm or get an IUD, then you won't have to worry about getting an abortion or making that choice when it comes to getting pregnant. I think if women were properly educated about several birth controls and were able to um, believe, I believe that it would decrease the amount of abortions every day. Although women get pregnant, I feel like they are using this as a backup plan. Abortion should not be a backup plan. You should be smart and use contraceptives and birth control and plan so that you don't get pregnant, and be smart about it, because a baby is a big responsibility, and if you're not ready for that, then you definitely should take the necessary precautions to not be pregnant. A resource for contraception and healthy sex states of women having abortions, 46% did not use contraceptive during the month they became pregnant. 8% never use a method of birth control, and 47 had at least one abortion. I really feel if women were able to be educated about birth control, then it would decrease the amount of abortions, and there would be a lot less problems with psychological and physical problems from abortion. If women are experiencing problems after abortion, they have several resources available to them. The most important is to realize your symptoms and get help as soon as possible. You can talk to your bishop, to your parents, anyone who is available, and get help before it results in a psychological disorder. Several studies and resources show that women who have an abortion will experience negative side effects immediately or sometimes right after. Sometimes they can begin several years after the procedure. Although physical side effects have been reported to be most commonly associated with abortion, physical side effects are also common. Although abortion seems like a quick fix to potential problems, it is not a simple procedure and should be taken very cautiously. Women need to be educated about the dangers of abortion and be able to know the effects on the woman after the abortion. In the United States, the abortion rates continue to go up, but the education goes down. We need to make sure that we are educating everyone so that they know the potential hazards of abortion. It is especially important that we use our resources so that we can educate everyone about abortion and the dangers that come with it.